Today we are going to discuss in Pediatrics the chapter Growth and its Disorders. Growth of the children and disorders of the growth. Okay, I will give the chapter's name Growth and its disorders. So, what is meant by this growth? Growth is an essential factor that distinguishes a child from an adult. So, the child can grow as they ages, but when the adulthood comes and when the maturation phase came, the people will not grow further in normal cases. So, the growth is an essential feature that distinguishes a child from an adult. The process of growth starts from time of conception and continues until child grows into a fully mature adult. Okay, this process starts from the time of conception, starts from the time of birth and continues until a child grows into a fully mature adult. So that is the time period of the growth. And the term growth and development I have given here. Growth and development. These are not same. These are not same meaning. So this growth and development are often used together but are not interchangeable because they represent two different phases or two different meanings of the dynamics of change. That means growth means it says about the quantity and development says about the quality. Okay, so this growth says about quantity. So the term growth denotes a net increase in size or mass of tissues. So what is mean by what growth denotes? Growth denotes the net increase in size or mass of tissues. Size. The difference in size denotes the growth, and it largely attributed to multiplication of cells and increase in the intracellular substance. So it is related to or attributed to multiplication. When size of the tissue increases, there will be multiplication of the cells. Multiplication of the cells and increase in the intracellular substance. Increase in the intracellular substance. So growth attributed to the multiplication of the cells and increase in the intracellular substance. Thus there will be an increase in size. Okay, so that called growth. And hypertrophy. What do you know? Hypertrophy or expansion of the cell size. Hypertrophy means expansion of the cells, expansion of the cell size. That's called hypertrophy. Contributes to a lesser extent to the process of growth. And development. In case of development, it says about the quality. Development specifies the maturation of functions. Maturation of functions. And what else? It is related to the maturation and myelination of the nervous system. Okay, maturation and myelination. maturation and myelination of nervous system, and also indicates acquisition of a variety of skills for and indicates the acquisition of variety of skills for optimal functioning of the individual. And development also indicates the acquisition, gaining of variety of skills for optimal functioning of the individual, for the functioning, for the optimal means the high level optimal functioning of the individual, for that acquisition of variety of skills for optimal functioning of individual. That's also indicates the development. And this growth and development usually proceed concurrently while they are discussed separately. Both growth and development are closely related. So we understand what is the difference between growth and development. Development means maturation of functions and myelination of nervous system. It says about the quality of that person, quality of that child. Okay. Now we are going to discuss about factors affecting the growth. First of all, fetal growth. Fetal growth is influenced primarily by fetal, placental and maternal factors. So, the fetal growth influenced by primarily by which are the factors? Fetal, placental and maternal factors. In humans, 40% of variation in the birth weight is due to genetic factors. In humans, 40% of variation in their birth weight is due to genetic factors, while the genetic factors. So the 40% in humans, 40% variation of in birth weight is due to the genetic factors, by the heritable factors, from the mother, father, grandfather, grandmother. So the birth weight come from them. So the genetic factors cause the birth weight of the baby in 40% of the human beings, and the rest of 60% is due to the environmental factors. Rest is up to due to the environmental factors. This is 40% due to genetic variation, and the rest is due to environmental factors. So the fetus has an inherent growth potential. The baby or fetus has inherent growth potential, and under normal circumstances grow into a healthy, appropriate sized newborn. And there is a maternal placental fetal unit. Maternal placental fetal unit, which acts in harmony to provide the needs of the fetus. This maternal placenta helps to provide needs of the fetus. Or the needs means nutrition to the fetus, given by this maternal placental fetal unit. Okay. Alright. Nutrition. Provide nutrition. Okay. And genetic potential. Next factor is genetic potential. Next factor in the fetal growth is genetic potential. So this is one factor, fetal placental and maternal factor. And genetic potential. Parental traits are usually transmitted to the offspring. Offspring means the babies, the infants. Parental traits are usually transmitted to their offsprings. Okay, that we know. And thus, tall parents have tall children, and the size of the head is more closely related to that of parents than our size and shape of the hands and feet. So the shape of the head may be more closely related to the parents than our size of the shape of the hands and feet. Their size and shape of the hands and feet may be closely related, but more closely related will be the head. So similarly, the structure of the chest and fatty tissue has better genetic association than the other somatic characters. Somatic characteristic means the body characteristics. So their fatty tissue and chest structure will be better, more similar genetic association, better genetic association than the body characteristics. And well, you determine the sex. The boys are generally taller and heavier than the girls. When you consider the sex of the male and female, boys are generally taller and heavier than girls at the time of birth. So, and that's the case of that. And let's move to fetal hormones.